You know, it's interesting because in Colorado at this point in time, we are seeing the highest levels of food insecurity that we've seen in over 10 years. And there are a lot of different causes to this. What we're hearing from neighbors who we serve, the rising costs of food, the rising costs of housing, presents them with difficult choices, whether they're able to put food on their table or whether they're able to stay in their home.
There's a whole lot of difference between just being able to eat and then eating nutritious food, and a lot of complexity that surrounds that. So as a dietitian, I always try and meet folks where they're at in helping folks find the healthiest version of themselves as that relates to what they're able to eat, what kind of food they're able to obtain.
Food insecurity can happen anywhere and to anybody, and we see that. We also know that we have doubled the amount of people that we have served in the last couple of years, and rapidly.
You know, many folks think that folks just want to go get free food. It's very disempowering, and it's very, that adds such a burden of stress and identity, really questioning one's identity. And who am I if I can't provide these basic things?
Yeah, I think the stigma of food insecurity is really difficult. And I see this every single week that we serve someone. I've seen one too many times people coming in with tears in their eyes and saying, I don't want to be here.
There is no one story to food insecurity, nor is there one face to food insecurity. I met a woman who, this is the first time I've done this. I'm 60. I've taken care of myself, worked my whole life. Costs are going up. I don't want to be here, yet I am.
Yeah. I think there's a common misconception or possible misconception that food insecurity just means that you don't have enough to eat. But it's true that more cost-effective options are typically calorie dense, but nutrient poor. And so I think we see a lot of overweight and obesity, and that is actually related more to food insecurity than it is to abundance.
If we're seeing this amount of food insecurity, we are ultimately going to be having holistic healthcare problems. I'm kind of curious if you all are seeing that in the medical side of things.
In my experience, it's not what is healthy. Like, people come into the office, they know the basics, right? It's really about how do I make that a consistent change in my life so that eventually the impacts of those actions manifest themselves in my health, and now maybe I need to take one less medication every month, which frees up my budget for one other thing,
Yeah, so there's that concept that I think is that food as medicine. And it's a funny thought because I don't think people think in those terms. That's the connection that I'm hoping that could be better made, is that we can always provide those foods so that people then can look at it like, I'm here to get healthy food and not just because I don't have any food.
A person who's food insecure is 2 to 3 times more likely to have diabetes. A person who's aging is 57% more likely to have coronary heart disease if they're experiencing food insecurity.
I think that's access to healthy options. And I think that's the struggle, right? Is that for those who want to eat healthy, that's great. But if they don't have an easy access to food, they don't have the financial means to buy that food from their grocery stores or wherever it may be, then that's going to be harder, even if that's something they really want to do.
And I think as a healthcare provider, it's something we should make standard to always ask, do you feel like you have enough food at home? A lot of times too, there's some concern about, well, if I have this diagnosis, if I have diabetes, that I have to now just eat completely healthy, completely not culturally relevant food. And I think it's our job as providers to tell them that's not the case and that we have good resources for that as well.
Intermountain Health have been leaders in our state with respect to screening patients for food insecurity, and that normalizes it. You were in a place to understand people's health, and we were in a place to provide them with nourishing foods and make it easy and remove those barriers.
One of the biggest success stories that I'm seeing directly is making gardening part of the human experience again. And what I'm seeing now with these outreach and education, especially when I'm working with the kids, oh my gosh, I can go in and teach a class on eating a rainbow. So identifying that different foods of different colors have different nutritional benefits. When they can actually take me out to their garden spaces, they're showing me, oh, hey, look at this. They're excited to eat that food.
Not a week goes by where I don't meet someone in my office who has some degree of challenge when it comes to accessing healthy or affordable foods. And that's something that we have to work together to kind of navigate and find a reasonable solution to.
There's not a single person who should face barriers to eating the foods that you're recommending to them. No one should face barriers to nourishing food.
Just seeing patients and meeting them where they are, and these very small changes or giving them resources for more access to home delivery of foods has been huge. And I've seen significant changes in health as a result of these partnerships. Thank you so much for being here. This was such an incredible conversation.
Of course, thank you so much.
Thank you.
Yeah.
Thank you.
Great.
Thank you. Thank you.
More, I know, you're,
Thank you for your leadership.
It's so nice to meet you.